Our subject today is brain vasculature, prepared by me, Huda Ali Kagum. Objectives: arterial supply of the CNS, including and the venous drainage of the brain. Arterial supply of the CNS is derived from internal carotid vertebra and vertebral arteries. There is anastomosis between internal and external carotid arteries, but little or no supply to normal brain is derived from external carotid artery. All arteries enter the surface of the brain are end arteries. They have no precapillary anastomosis, and obstruction of them causes infarction of the supply territory. First, we'll start with internal carotid artery. It enters the cranial cavity through the carotid canal in the petrous part of temporal bone. It is divided into 7 segments. First segment, cervical segment, start from carotid bifurcation until it enters the carotid canal. It has no branches. Second segment is the petrous segment. It starts from inside the petrous part of temporal bone, inside the carotid canal, and continue until the foramen lacerum. It has 3 portions: ascending, genu, and horizontal portion. It has 2 branches: pterygotympanic arteries and pterygoid artery. Third segment is the lacerum segment. It is a short segment, lie above the cartilage, covering the foramen lacerum and end just before the cavernous sinus. Also, it has no branches. The fourth segment is the cavernous segment. It starts when it enters the cavernous sinus. At first, it passes toward the posterior clinoid process, forming the posterior genu, then passes upward on the medial side of anterior clinoid process to forming the anterior genu. It has 2 branches, meningo-hypophyseal branch passing posteriorly, and infralateral trunk passes anteriorly. Clinoid segment is short segment. Start when the internal carotid artery exits from the cavernous sinus, after which it is considered intradural. Also, it has no branches. عفوا البوينتر واضح؟
واضح بس تقدرين تستخدمين غير واحد.
تمام. هذا أوضح دكتور؟
لا بالعكس ذاك أوضح أبيض. هذا
راح أرجع على الأرو.
اوكي اوكي
تمام أستاذ. Ophthalmic segment, it extends distally to the origin of posterior communicating artery. It will pass parallel to the optic tract, and also it has 2 branches: ophthalmic artery and superior hypophyseal artery. Ophthalmic artery will first large branch of internal carotid artery, when visible on angiogram, who will first branch after exiting from the cavernous sinus. It passes anteriorly and enter the optic foramen. At first, it will be inferior and lateral to the optic nerve, but then cross over the nerve to go to the medial orbital wall, as shown in this picture. The last segment is the communicating segment. It starts from the origin of posterior communicating artery until the terminal bifurcation of internal carotid artery. It has 3 divisions: posterior communicating artery, anterior choroidal arteries, and striate arteries. The terminal divisions of internal carotid artery are anterior cerebral artery, passing anteriorly, and middle cerebral artery, passing laterally. Here, an internal carotid angiogram, AP view, showing the segment we talked about. Here, the cervical segment, petrous segment, cavernous segment, carotid siphon. Carotid siphon is the cavernous and supraclinoid portion of internal carotid artery. Number 5 represents intracranial part of internal carotid artery before bifurcation to anterior cerebral and middle cerebral arteries. Here the branches of anterior cerebral artery, callosomarginal and paracallosal artery, choroidal arteries, striate arteries, and here the branches of middle cerebral artery. This is the same internal carotid angiogram, but lateral view. The same segment, cervical, petrous, cavernous, carotid siphon, intracranial part, anterior cerebral artery, middle cerebral artery. This is the ophthalmic artery, callosomarginal and paracallosal artery. Anterior cerebral artery. It passes superior to the optic chiasm. Then it went around the genu of corpus callosum and continue posteriorly on its upper surface. It has 6 branches. First is recurrent artery of Hobner هو الفيرست branch من pre-communicating segment. This is the pre-communicating segment before it gives the anterior communicating artery here. Then it gives 4 branches, 2 anteriorly. الأسفل من عندهم هو الأوربيتوفرونتال، الأعلى أوربيتو frontopolar. Then went around the genu of corpus callosum to give the callosomarginal, and the continuation will be paracallosal artery. Internal carotid angiogram showing the cortical branches of anterior cerebral artery. Here the ophthalmic artery. This is the anterior cerebral artery, orbitofrontal, frontopolar, callosomarginal, and paracallosal arteries. Middle cerebral artery, this is the largest and most direct branch of internal carotid artery. It passes laterally and ends as cortical branch, supplying the insula, operculum, and cortical branch. Also, it gives medial and lateral lenticulostriate arteries. One of these arteries will be larger than the other and called artery of cerebral hemorrhage, which is most frequently ruptured. Also, it gives anterior temporal artery here and divided into 4 segments. This is M1 segment, here M2 segment, M3 opercular segment, and M4 cortical segments. Another picture, this is left internal carotid artery, giving left middle cerebral artery, anterior temporal, and bifurcation of MCA, giving finally the cortical branches. Also in this picture, internal carotid artery, giving the posterior communicating, anterior choroidal, anterior cerebral artery, anterior communicating, recurrent artery of Hobner, medial and lateral lenticulostriate arteries of MCA, and MCA bifurcation M2 segment. CT angio, segmental vertex view, showing the bifurcation of left MCA. This the anterior temporal artery, bifurcation of right middle cerebral artery, opercular branch, and cortical branches. Vertebro-basilar system. The vertebral artery arises from posterior-superior aspect of first part of subclavian artery. The left vertebral artery will be the dominant in 80% of people. When it arises from subclavian artery, it passes upward to enter the transverse foramen of 6 cervical vertebrae and continue upward, intraforaminal. When it exits from the transverse foramen of C1, it passes posterior to its lateral masses. Then continue through the foramen magnum to enter the skull and run anterior to the medulla, where it unites with vertebral artery of other side at the lower border of the bones, forming the basilar artery. هذه الصورة واضح بها difference بالكاليبر بين الرايت والليفت vertebral arteries، لأن احنا قلنا left هو dominant in 80% of people. Branches of vertebral arteries. In the neck, it will give muscular branch to deep muscles of the neck, spinal branch to the vertebrae and the spinal cord. Inside the skull, the most important 3 branches are posterior spinal arteries will descend as 2 separate branches, anterior and posterior to the dorsal root. Anterior spinal artery. These arteries will unite in the midline and descend as single anterior spinal artery. This is the most important and largest branch of vertebral artery is posterior inferior cerebellar artery. It arises from intracranial part and terminates as medial branch, inferior vermian artery, and lateral branch to the inferior surface of the cerebellum. Basilar artery. Basilar artery is formed by union of two vertebral arteries at the lower border of the bones. It lies close but seldom exactly in the midline. And in the prepontine cistern, when it deviates from the midline, it do so to the side away from that of dominant vertebral artery. As we mentioned before, the left vertebral artery will be dominant 80% of cases. The visceral artery, when it deviates, will deviate to the right side. Basilar artery branches. Here, two vertebral arteries unite at the lower border of the bones, forming the basilar artery. It will give pontine and labyrinthine branches. Anterior inferior cerebellar artery, superior right and left. طبعا paired. كل هذه البرانشز هي paired, one on each side. Superior cerebellar artery here, right and left. This artery arrives near the terminal branches of basilar artery, passes posteriorly and laterally around the cerebral peduncle, supplying superior surface of the cerebellum, pineal gland, and bones. The terminal branches of basilar artery, right and left posterior cerebral arteries. Posterior cerebral artery here, it receives the posterior communicating artery from internal carotid artery to complete the circle of Willis. Also, it passes laterally and posteriorly, superior and parallel to the superior cerebellar artery, but separated from it by the tentorium. The branches of posterior cerebral artery. It receives the posterior communicating, give the thalamostriate or thalamoperforating arteries, medial and lateral posterior choroidal arteries, and give branches, cortical branches, internal temporal branch and internal occipital. Internal occipital will end as calcarine and parieto-occipital. Also, it gives the splenial branch, here the temporal, parietal, and occipital. In this picture, it explains the segments of posterior communicating artery, posterior cerebral artery. Here, the pre-communicating segment before it receives the posterior communicating artery. Here, the ambient segment in the ambient cistern, quadrigeminal segment in the quadrigeminal cistern, and finally, P4, the calcarine segment, P4. Also here, the same branches of posterior cerebral artery, con parallel superior cerebellar, con بيناتهم oculomotor nerve, here the temporal branch, internal occipital, calcarine branch, and parieto-occipital branch. Pre-communicating segment, ambient segment, quadrigeminal, P3 segment. The vertebrobasilar angiogram, here showing the segment, pre-communicating, ambient, quadrigeminal, and calcarine P4. Here showing the branches of posterior cerebral artery, thalamostriate arteries. Here, posterior temporal, anterior temporal, calcarine, and parieto-occipital arteries. The arterial circle of Willis. There is anastomosis between right and left internal carotid arteries, their branch, and posterior cerebral artery through the posterior communicating to form the circle of Willis in the supracellular cistern and interpeduncular cistern. The circle of Willis encloses the pituitary stalk in the supracellular cistern. It is complete in 90% of subjects, but variation of at least one vessel is enough to affect its role as a collateral and is present in 60% of people. The most commonly variant vessel هو posterior communicating artery here. This picture also shows the circle of Willis in right internal carotid artery, giving anterior cerebral artery, anterior communicating, left anterior cerebral and posterior communicating right and left posterior cerebral arteries. The most common variant of cervical office. As we mentioned previously, the most commonly variant vessel هو posterior communicating artery. هذا الارتري اما يكون small hypoplastic in 22% of cases او بالعكس راح يكون large. بالحالة اللي يكون بيها large الابسيلاترال راح نسميه fetal posterior communicating artery. بهالحالة راح يكون posterior cerebral artery اما hypoplastic or even absent as shown in these pictures. Third variant of cervical office هو pre-communicating hypoplastic pre-communicating segment of anterior cerebral artery as shown in this MR angiogram. And the vertical segment will be supplied from anterior cerebral artery of other side through anterior communicating. Other variant is hypoplastic anterior cerebral artery in 3% of cases, or the anterior cerebral artery will fuse a single trunk, and we called it azygous anterior cerebral artery. Radiological features of arterial supply of the CNS. Plain radiograph. The arteries are usually not visible unless calcified. This most commonly occur in the carotid siphon near the pituitary fossa. As we mentioned previously, carotid siphon هو cavernous and supraclinoid portions of internal carotid artery. Second, angiography. This can be achieved through the aortic arch by single femoral artery injection. Internal common carotid arteries can be catheterized in turn, and view of both vertebral arteries usually possible by injection into one vertebral artery with retrograde filling of either from the basilar artery. The left vertebral artery will be catheterized first. أحد يعرف ليش catheterized first left؟ ألو؟
لأن dominant
نسمع
لأن هو
بالضبط
large
لأن هو dominant in 80% of subjects. The arterial supply of left and right side of brain are connected through anterior communicating artery and by the union of two vertebral arteries through the basilar artery. Competence of this communication demonstrated angiographically by selectively injecting contrast into one carotid artery while maintaining steady pressure on that of the other side. This cerebral angiogram showing perianeurysm projecting from the top of basilar artery. CT and MRI. Contrast enhancement aids visualization of vessels on CT scanning, while vessels are usually visible without contrast on MRI. Vessels in cisterns are particularly well seen on T2-weighted images because of the difference between relaxation constant of the CSF and that of the vessel wall. MR angiography allowed direct visualization of cervical office and its branches without contrast injection. This is MR angiography showing the cervical office and its branches. Here, the right middle cerebral artery, right anterior cerebral artery, ophthalmic artery. Here, the pre-communicating segment. Here, the vertical segment. Left internal carotid artery, left middle cerebral artery, left posterior communicating, left posterior cerebral, superior cerebellar, anterior inferior cerebral. This is the basilar artery, and left vertebral artery giving the posterior inferior cerebellar artery. Ultrasound examination of a neonatal brain. On ultrasound, the collagen sheets of the vessels give them echogenicity. On real-time studies, pulsation of middle cerebral artery can be seen on the insula, and the anterior cerebral artery can be seen in the interhemispheric on coronal scanning. On parasagittal scanning, we will see the branches of anterior cerebral artery, callosomarginal, pericallosal artery, and here vein, great cerebral vein of Galen. طبعا بالكيسات اللي تكون بها partial agenesis of corpus callosum راح نشوف البريكالوزال artery متوقف ويا حد الcorpus callosum. Brain arterial territories. Most of the lateral surface of brain supplied by middle cerebral artery, while internal medial surface and supralateral surface supplied by anterior cerebral artery, while the blue-colored part, including occipital part of temporal lobe, supplied by posterior cerebral artery. CT scan showing infarct involving area supplied by anterior cerebral artery here and here. Here, area supplied by middle cerebral artery. And in this picture, sagittal and axial view infarction in area supplied by posterior cerebral artery. Till now, any question?
اكو احد عنده سؤال على الانتراكرينيال ارتريال سيستم؟ ماكو. تفضلي خلينا نكمل فينس.
تمام، نكمل venous drainage of the brain. يشمل 4 مجروعات: الdural venous sinuses, superficial and deep cerebral veins, and veins of posterior fossa. The veins draining the brain will not follow the same course as the arteries supply them. They drain except veins draining deep structures will drain to the deep cerebral veins, which in turn drain to the dural venous sinuses. Also, they do not have any valves. Dural venous sinuses. These are low-pressure veins within the folds of the dura, except the inferior sagittal sinus and straight sinus will be situated between the 2 layers of fibrous dura. They receive blood from the brain and from the skull. Diploid veins here also communicate with veins of the face and the skull, emissary veins here. And here the arachnoid villi. There is 3 to 4 venous legs project from each side of superior sagittal sinus. Into these legs, the arachnoid villi project to return the CSF to the blood, as we will see in next slide. Superior sagittal sinus starts anteriorly and passes in the midline posteriorly to the internal occipital protuberance. Veins enter the sinus obliquely against the flow of blood, and on each side, as we mentioned, 3 to 4 venous legs. بداخلها راح يكون arachnoid villi which return the CSF to the blood. Posteriorly, superior sagittal sinus will turn to one side, usually right side, to become the transverse sinus. Here, the inferior sagittal sinus run in the lower 3 edge of falx cerebri and passing posteriorly to communicate with the great cerebral vein of Galen, forming the straight sinus. Straight sinus run in the tentorium cerebelli when it is attached to the folds to the internal occipital protuberance here. Here will be the confluence of veins. When it passes posteriorly, it turns to one side, usually the left side, to become the left transverse sinus. Transverse and sigmoid sinuses. They run from the confluence of veins to the right and left toward the mastoid bone, where it passes interiorly to become the sigmoid sinus. أحيانا الsigmoid sinus together with the transverse sinus نسميهم lateral sinus, which will continue through jugular foramen to internal jugular vein. The jugular bulb هو focal dilatation inside the foramen. نسميه jugular bulb. Here the superior sagittal sinus, transverse sinus, هذا sigmoid sinus. Cavernous sinus. The cavernous sinus situated on each side of pituitary gland and body of sphenoid. Internal carotid artery passes between the dural layers forming the cavernous sinus, with the abducent nerve will be inferior and lateral to it, while on the lateral wall of the sinus will be the oculomotor, trochlear, ophthalmic, and maxillary division of trigeminal nerve. When it emerges from the cavernous sinus, the internal carotid artery will be on the roof of the sinus, and the optic tract superior to the sinus. Cavernous sinus receive blood from ophthalmic veins. This is superior ophthalmic vein, inferior ophthalmic vein, sphenoparietal sinus, pterygoid venous plexus, and from middle superficial superficial middle cerebral artery اللي هو ضمن مجموعة السوبرفيشال راح نتكلم عنها بالنكست سلايدز. receive blood من هذه superior ophthalmic, inferior ophthalmic, sphenoparietal والpterygoid. زين drain blood to the superior petrosal sinus and inferior petrosal sinus. Superior petrosal sinus start from the cavernous sinus and drain to the sigmoid sinus. superior S ويا sigmoid أيضا S. inferior petrosal sinus حرف ال I to the internal jugular vein. هنا ال superior petrosal sinus راح يكون بال upper surface of petrous bone، هنا at the base of petrous bone. Sphenoparietal sinus drain to the cavernous sinus situated on the free edge of lesser wing of sphenoid. ننتقل للمجموعة الثانية اللي هي superior cerebral veins. Superior cerebral veins consist of 3 veins. Here, the superior anastomotic vein of Roland passing posterior-superiorly to the superior sagittal sinus, as in this picture, and inferior anastomotic vein of Labi passing posterior-inferiorly to the sigmoid, to the transverse sinus, and superficial middle cerebral vein اللي تكلمنا عليه قبل شوية will drain to the cavernous sinus. deep cerebral vein اللي هي المجموعة الثالثة من الفينس drainage فيها 3 veins 3 main veins. internal cerebral vein اللي هم 2 veins 1 on each side. basal vein of Rosenthal also 2 veins 1 on each side، هذا واحد هذا الأذر. great cerebral vein of Galen here short. internal cerebral vein of Galen يتكون من اتحاد 3 veins choroidal, thalamostriate and thalamostriate and septal veins. منطقة اتحادهم تسمى الفينس أنجل. راح يتكون internal cerebral vein يلتقي ويا الأذر internal cerebral vein of other side حتى يكون great cerebral vein of Galen. البيسال vein of Rosenthal أيضا يتكون من اتحاد 3 veins وdrain to the great cerebral vein of Galen. The great cerebral vein of Galen short segment receive internal cerebral veins, basal vein of Rosenthal of 2 side and veins of posterior fossa. And in the anterior drain to the anterior end of straight sinus where it unite with this inferior sagittal sinus. We talk about this slide. Lastly, the veins of posterior fossa. It include anterior pontomesencephalic vein, posterior mesencephalic vein, lateral mesencephalic vein. Precentral cerebellar vein here, superior vermian, inferior vermian, pontine and medullary veins. Here, internal carotid angiogram showing the venous drainage of the CNS. Superior sagittal sinus, here giant arachnoid granulation. Inferior sagittal sinus, straight sinus, here the confluence of veins, transverse sinus, sigmoid sinus, jugular bulb, internal jugular vein. Here the cavernous sinus, pterygoid venous plexus, superficial middle cerebral vein will drain to the cavernous sinus, and internal cerebral vein drain to the great cerebral vein of Galen. Here the basal vein of Rosenthal. طبعا ال superior sagittal sinus راح يكون triangular on cut sections, axial sections. Radiological features of cerebral veins and sinuses. Skull radiograph. The course of the venous sinuses. The course of venous sinuses can be seen where they groove the inner plate of bone. قسم من عندها واضح هنا. والarachnoid granulation also will be seen as lucencies on each side of superior sagittal sinus. MR venography هو the primary non-invasive method for demonstrating cerebral veins and venous sinuses. As in this picture, MR venogram of deep cerebral veins. Here the inferior sagittal sinus internal cerebral veins formed by union of 3 veins to drain to the great cerebral vein. Here the basal vein, both of basal vein of Rosenthal of both sides. Angiography during venous phase. Superficial veins will fill before the deep veins, and the frontal veins before the posterior veins of the superficial group. Superior and inferior anastomotic vein is often visualized, but seldom seen on one angiogram. In this picture, internal carotid angiogram showing superior sagittal sinus, cortical veins. Here, internal cerebral vein, great cerebral vein of Galen, straight and transverse sinus, sigmoid sinus. Here, the inferior sagittal sinus, وهنا هذه الفينس انجل، هذا السوبرفيشال ميدل سيربرال فين اللي راح ينتهي بالكافيرنس ساينس. CT and MRI. Tentorium and folds are seen relatively hyperdense لأن يحتوون داخلهم الفينس sinuses. الفينس sinuses may be seen قريب ال internal occipital protuberance اللي احنا قلنا عليه ال confluence of veins. High division of superior sagittal sinus may occur at an unusual normal variant and should not be mistaken for sinus thrombosis. هذه البيكتشر contrast enhanced CT showing a triangular area of enhancement with a relatively low attenuating center representing a thrombosed superior sagittal sinus. Any question?
اكو احد عنده سؤال الدكتورة هدى على الفيناس سيستم؟ اذا ماكو نروح على الكويز. تفضلي دكتورة هدى، خلينا نروح على الكويز. تفضلي.
نعم أستاذ.
دكتورة رحيمة.
نعم دكتور. The first question is the internal carotid artery enter the subarachnoid space just inferior-medial to the posterior clinoid process. False. It enter inferior-medial to the anterior clinoid process.
Excellent. صحيح. لينا.
Number 2.
نعم أستاذ.
تفضل.
The cavernous sinus communicates with the superficial middle cerebral vein. True.
بلي هو السوبرفيشال هي قالت أكثر من مرة عادته السوبرفيشال ميدل سيربرال فين ترمينيت بالكافرنس ساينس. اكسلنت. دكتور محمد إبراهيم.
نعم أستاذ. The circle of Willis is in the suprasellar system. True. The anterior part of the circle of Willis.
Excellent. نارين أصمت.
نعم أستاذ. The right and left posterior cerebral artery are the first branch of the basilar artery. False. Are the terminal branch of the basilar artery.
Excellent. عاشت ايدك. وأخير واحد هونر.
نعم أستاذ. The superior sagittal sinus is roughly circular in cross section. False أستاذ. It is triangular in shape.
Excellent. It is triangular. اوكي تفضل استاذ محمد.
شكرا استاذ رعد. عائشة عبد الحميد.
A anterior communicating artery.
سؤالين.
نعم أستاذ. B هو right anterior cerebral artery. That's the horizontal segment A1.
نعم. ثانية لواء سي.
نعم أستاذ. This is the internal carotid artery, right internal carotid artery.
نعم. صفاء عباس.
نعم أستاذ. الدي هي anterior cerebral artery segment 2.
نعم. زينة فاضل.
posterior communicating arteries.
والإف
لازم
رواسي
تقولون
فاهم.
الإف للرايت. لازم تقولون
أستاذ هي
الإف
مأشرة عليهم اثنين. العفو أستاذ مأشرة هي على الاثنين.
اوكي إيه.
هذا
صح.
البيكتشر اثنيناتهم.
بس الانتيريور سيربرال كان اثنيناتهم ممشر لو بس
لا
واحد؟
الليفت.
بس
Left.
الليفت. اوكي.
رواسي.
نعم أستاذ، الأف في posterior cerebral arteries
نعم.
right and left.